Hi, everyone. Welcome to today's edition of Stanford Live. I'm so excited to have our APP Cancer Center team here today, ready to talk to you about inpatient, outpatient, all of the things. So any questions that you have throughout this entire live event, please feel free to drop it in the comments, depending on what platform you're on, and our team will answer. To get us started, I'm going to pass it over to Deepa Shah, the director.
Hi, everyone. Good afternoon. Thank you for joining us today. My name is Deepa Shah, and I'm the Director of Advanced Practice Providers at Stanford Healthcare. I am so happy to be here today to discuss the exciting opportunities we have for advanced practice providers within our cancer center. Joining our cancer team means you're becoming a part of an institution that's recognized on U.S. News and World Report Honor Roll, where we are nationally ranked in 11 adult specialties, including cancer. We are also proud to hold the designation of an NCI Comprehensive Cancer Center, which underscores our commitment to providing exceptional cancer care. At Stanford Healthcare, we have a well-established Center of Advanced Practice led by our Chief Advanced Practice Officer. We're dedicated to supporting our APPs through comprehensive onboarding, specialized cancer center orientation, and a robust mentorship program. Additionally, we offer an accredited APP fellowship program in oncology, which is recognized for its excellence. Our Stanford community consists of nearly 1,000 advanced practice providers, our cancer center being one of the biggest groups with almost 200 APPs. Our APPs work across multiple locations, including Palo Alto, Redwood City, South Bay, Pleasanton, and Emeryville. Our APPs have the opportunity to practice in various settings, including ambulatory clinics, our Oncology Rapid Assessment Center, inpatient services, and surgical services, covering areas such as medical oncology, hematology, bone marrow transplant, surgical oncology, and radiation oncology. If you're passionate about making a difference in cancer care and want to be part of a collaborative and an innovative team, I encourage you to consider joining us at Stanford Healthcare. Together, we can continue to advance in the field of oncology and provide exceptional care to our patients. Thank you so much for your time. I look forward to connecting with you. And I will now pass it on to Aarti Jairam Todla, who is our ambulatory APP manager.
Thank you, everyone. Welcome, and thank you for joining us at our live event. I'm Aarti Jairam. I am the APP manager for Cancer Ambulatory Care. And we are here to talk to you about all things to offer at Stanford Cancer. So I'll focus here on our cancer center clinics. We have clinics across all disease groups, solid tumor, hematology, BMT, radiation oncology, supportive oncology, palliative care, and survivorship programs. And all of these areas have roles for our advanced practice providers and practicing to their top of their scope. As you know, Stanford is an NCCN institution, and so our focus for our APPs is not only caring for patients with cancer, but also providing cutting-edge research and clinical trials for our patients. And so in our practice here at Stanford, our APPs are very critical in the role of review for eligibility and enrollment and managing patients on clinical trials. So if you are interested in growing professionally as an APP, really becoming an expert in your disease area, providing cutting edge treatment and learning to be the expert in your area of oncology, this is the place to be. And we are actively recruiting for positions in the ambulatory area. And I do have one of our APP leads here, Sam, who can speak to one of the positions that is currently open and recruiting. So I will pass it over to Sam.
Thanks, everyone. My name is Samantha Balakrishnan. I am the lead APP for our thoracic oncology as well as our neuro-oncology program here in the Cancer Center at Stanford. Thank you so much for joining us all today. I have worked in our Cancer Center for a little more than 5 years and have been the lead for the majority of that time here at Stanford. One of our open positions is within the thoracic oncology department, as Arthi just mentioned, and I'm happy to take any questions about that as our presentation goes on. We are a very fast-paced, dynamic team, one in which the APPs are expected to know a lot and be kind of at the top scope of their practice. There are a lot of opportunities for both mentorship, learning, research, as well as some practice among the APPs in that little bit more independent type of role as well. Lots of opportunities for growth and professional development as well. And one of the things that I love about working at Stanford is how much support we have both from our leadership team, Deepa and Arthi, who you just met, as well as a couple other people you're getting ready to hear from as well. And that goes all the way up through leadership, all the way to the top. And so I really want to encourage anyone who's interested in learning more about our program to please reach out, as well as asking questions in this forum today. So with that, I will hand the baton over to Allison.
Hi, everyone. My name is Allison Morris. I am the APP manager of our cancer network. And as Deepa mentioned in the introduction, we are expanding our footprint and have cancer centers in the South Bay, in Emeryville, Pleasanton, Castro Valley, and Redwood City. So I oversee APPs in all of those locations. And one of the things I appreciate about kind of Stanford's mission and vision in caring for oncology patients is we really want patients to be able to get care within their communities. And so having, locations in all these areas really help us keep cancer patients in their communities, with their families, with their care teams that we get a chance to be a part of. Some of the things in the network that we love is being able to work parallel to our physician colleagues in partnership and collaboration with them, really working side by side to ensure we have access for patients to care. And that is mostly in the outpatient setting. We also have oversight of our infusion treatment areas. We have APPs who are in the ORs and do inpatient rounding as well as in the clinics. So very dynamic roles, these roles really do have quite a spectrum in terms of role responsibility and scope of practice that we find very fulfilling and rewarding. And we have a couple positions open in the network, and it is a space that we're growing in. And so definitely anticipate more growth in the near future. And I will pass it off to my colleague, Jevin.
Hi, everyone. Thanks for joining us today. My name is Jevin Gag-Mitchell. I'm the APP manager for inpatient oncology. So I work with the teams that take care of our bone marrow transplant and cellular therapy patients, and our oncology rapid assessment center, which is our urgent care-like setting where we see patients same day with acute issues, and also our inpatient hematology oncology services that are kind of like hospitalist services, caring for heme and onc patients. We have lots of exciting positions in these on these different teams, different roles, depending on kind of what specialty you're interested in. If you like procedures, a lot of our acute care oncology APP positions do include procedures. We have opportunities too, just for, I would say, really top of licensure practice. There's a lot of autonomy in a number of these roles, but at the same time, just really excellent physician partners that we work with. So lots of great opportunities for learning, collaborating on projects. Overall, I would just say Stanford is really an incredible place to work as an APP. There's so much support, so many interesting things going on, opportunities for learning, and just opportunities for growth as an advanced practice provider. For our BMT and cellular therapy APPs, they work in a number of settings, inpatient, of course, but also in the clinics. and in the infusion treatment area. So really a lot of options depending on what setting you prefer. And I'll pass the baton over to my colleague Emily, who will tell you a little bit more about what we call Med 9 and Med 11, our two teams that are primary services for inpatient hematology and oncology patients.
Hi, thank you. I'm Emily Morse. I'm one of the co-leads for Med 9 and Med 11. As Jevin mentioned, we're primary inpatient teams. So Med 9 cares for our hematology and oncology patients in the hospital. And Med 11 is primarily for our solid tumor patients, although we do some overflow. And both teams are, really APPs are the caregivers. We're the primary providers for those patients who are in the hospital. And we manage all levels of their care and work with consultants and with our attending physicians. And it's a really great team environment. You get a lot of support with your coworkers, a lot of great opportunities for learning. As Jevin mentioned, we do procedures, and there's opportunities to teach. We do, onboard new hires, and we also work with the fellows. So it's a really good team to kind of learn all aspects of medicine and then get to manage these extra aspects of oncology patients and hematology patients. And we tend to have, openings arise because we're a pretty large team with the two teams. So we're often looking for new hires.
Thanks so much, Emily. Well, I will get us started here. I'm going to pick on Allison and Javon first. So when people look at different cancer centers, of course, we have competition out there, but of course, we're all pretty biased that Stanford's the best one. So for anyone out there looking for a new opportunity, they're considering Stanford, what are some reasons why you guys chose Stanford as your place of employment? What keeps you here? What keeps you just committed to Stanford and its patients?
You want to go first?
Sure. Yeah. Stanford takes really good care of their employees across the board. As APPs, we have a lot of support from our leaders. We have a super robust leadership structure at Stanford. We really, have prioritized a model where advanced practice providers report up to leaders who are also advanced practice providers. So your manager really understands what you do on a day-to-day basis, and I think that really helps our staff feel feel understood and just feel generally a lot of support in the work that they're doing.
Yeah, I agree with that. I think I have found in oncology that we really all are there to provide the best patient care, and I really appreciate the thoughtfulness and the intentionality that we have to each other as coworkers, and also the kind of level of care we provide to oncology. And I feel like we all really work very well together to ensure patients get the best care. So on the clinical piece, I do feel that we have a lot of resources. We have a multidisciplinary care team, and even if that's not our immediate team, as Arthi mentioned, we're well connected to all these other groups, so it's very easy for me to reach out to an APP in palliative care, to kind of pick their brain on something or, connect them with a patient. If a patient needs radiation oncology or, any other number of kind of specialty care, we have APPs in all of these areas, and there's a lot of things, a lot of ways that we can be connected to one another kind of across the organization and within the institution. And so I do feel like patients get very specific individualized care because of the lines of communication that exist, and the ways in which our kind of overall APP leadership team really does foster, getting to know one another and teamwork and collaboration.
I love it. Good to hear. All right, well, I'm going to pick on Sam next. So Sam, kind of the same scope, can you walk us through what a day in the life of looks like here? What can someone expect when they come to Stanford, kind of what their patient caseload looks like, the type of patients that they're working with, what makes it, so unique to be at the cancer center versus being at another hospital or another cancer center in the state of California?
Absolutely. So a typical day for our APPs may start somewhere around the hour of 8 a.m. Some do come in a little bit early to make sure that they're well-versed in the patients that they're seeing for the day, doing a little bit of prep work, making sure they're looking at lab scans, etc. And as they're running the list for the day and looking at the patients on the schedule, they're ensuring that all last minute issues are taken care of, or any kind of fires that maybe have arisen from the day before. So in collaboration with the nurses and some of the schedulers that also are with them in clinic alongside their physician colleagues, they may look at the patients that are being seen for the day on everyone's schedule to ensure that there's good communication happening, and that if there's any issues that they anticipate may be arising, that everyone's kind of touching base about those things early on in the day. As the day goes through, this APP or individual may be seeing on average about 5 or 6 patients. And this is if a APP happens to be a well-experienced APP that has been here for a while and feels comfortable doing such number of patients, but typically around 5 or 6 patients that morning. Our patient visits are anywhere from 30 to 60 minutes, depending on the type of visit that they're seeing. And the types of patients that they often see would be patients that are either coming back for treatment, and they're doing kind of a toxicity check, making sure that the patient is safe to receive that treatment. And then the APP often will go ahead and prescribe the chemo for that patient. In addition to chemo checks, our APPs often will see patients that are sick or ill and have new symptoms that need to be addressed that same day. We work very hard to see our patients, address all of the issues and symptoms that they're having so that we can keep their level of care from needing to be escalated if at all possible. While we do have resources such as our ORAC, which is the Oncology Rapid Assessment Center, which we kind of think of as almost like an urgent care for our patients in oncology. If the team can handle some of the patient needs at the team level, that's obviously the best option for that patient as we know them best. So the APPs will often see those patients. In addition, any patients that are becoming discharged from the hospital, we want to make sure that we see them in a timely way to make sure that they're clear on the discharge plan and that any needs that may have arisen since they left the hospital are being addressed as well. So those are kind of the typical patient visits that we might see. Some of our APPs do shared visits with our physician colleagues, and a lot of those happen to be with our new patient population. So the APP will often do a lot of the workup and the prep work to anticipate what might be needed from that patient in terms of education, possible chemotherapy, introduction to clinical trials, and any other kind of ancillary or support services such as palliative care, our care coaches, other education that might be needed from our nursing colleagues as well. And so often those visits are done in collaboration with the physician, where that patient may see both the APP and the physician during that visit. So those are kind of typical visits. Our APPs do also attend tumor boards, and for each kind of specialty, the tumor boards happen at various different times throughout the week. The APPs also help with the clinical trials and seeing patients for those clinical trials. Many of our APPs also do procedures such as lumbar punctures, Omaya, reservoir, either administration of chemotherapy, taking out the spinal fluid for some of those patients. Some do paracentesis, pleurodesis. So there's various different things that our APPs do, both on the inpatient and outpatient setting as far as procedures go. And many of those are done on the outpatient side in the actual clinic rooms or procedural rooms. So there's a wide variety of different tasks throughout the day. And all along the patients that they're seeing, they're also communicating with our nursing staff and making sure that any patients that are calling in or writing messages through our medical record system, that those are getting addressed in a very timely way and being triaged appropriately as well. At the end of the day, there's typically another check-in kind of with either the nursing staff and our physician colleagues, or both. Ideally, that happens with everybody on the team, and any kind of last minute issues that maybe have arisen that the APP hasn't yet got to. We work very hard to ensure that our APPs have time built in throughout their day to be able to address all of those issues, so that we can make sure that things are triaged quickly, taken care of quickly, and that the patient gets a response and gets the treatment that they need very quickly as well. Happy to take any further questions if that's something that is of interest to people.
Thank you so much, Sam, for that comprehensive overview of just kind of the day in the life. I'm going to pass it over to start with RT, and then I'm going to pass it over to Allison and Javon. You know, she touched on chemotherapy. It's kind of a reminder of the type of patients that we do work with at the Cancer Center. Given that they are chemotherapy patients, unfortunately, sometimes there is the death and dying part that plays into it. So when, you know, people come into Stanford as an APP, what supports are available to them? If there is a day where they unfortunately lose a patient, what supports are available? What does the team do to kind of build that camaraderie so they feel like they have a support system at work for some of those days that are a bit more of a struggle than others?
Thank you. Yeah, that's a great question. Number one, I'll say is we have a very collaborative practice with our physicians here at the Cancer Center, meaning that APPs that are seeing oncology patients, managing chemotherapy, we have a very close relationship with the physicians we work with. And these patients are alternating between seeing us and seeing the physician, and we're taking care of these patients throughout their journey of cancer. And so those conversations around end of life, goals of care, they're happening, with the APPs as well, because we are developing very close relationships with these patients. That being said, we have a lot of support in training and helping our APPs feel empowered to have these conversations, right? We have courses and training sessions for APPs to be able to feel comfortable approaching patients on these topics, have the, right sort of set of words to say, and, how do we engage patients in this to help support their best quality of life at the end of life. And, that is heavy work, and it isn't for everybody. But, if you are passionate about cancer and cancer care, this is a place where we will support you to grow in that way and be able to take care of patients to the best of your ability. In terms of supporting, how to take care of ourselves, we have a very large group of APPs in cancer. We have over 83 APPs just in the clinic setting, in the ambulatory setting. And so wellness is front and center for us and is actually, part of our yearly initiatives. We are looking at different programs now to support APP wellness. And we actually have APP champions for wellness within different disease groups, so that we can organize events, organize, activities, organize wellness support that comes to the clinic, and whether that's treats, whether that's food, whether that's meditation classes, whether that's pet therapy. We're always brainstorming on different ideas on how to support our APPs in wellness. I think the other piece I'd say is this is one of the reasons I really enjoy working here is you have a tremendous set of colleagues, and a lot of smaller cancer centers, right? Just the numbers are not as high. And so here you're never alone. You always have someone to talk to. You have another APP colleague to reach out to. in different specialty areas, in your same specialty area. It's a team, and it's a team effort. So we always have camaraderie in that to support each other. And I think that is a huge part of our wellness as providers, to help reduce burnout. When we poll our staff in terms of what keeps them here, that is something that we hear loud and clear. It's their team. It's their team and the people they work with, that make them feel at home, that make them stay, that may help them handle the heavy work that is being done. Thank you.
All right, Allison, you guys are up.
I don't know that I have much or much of anything to add. I think, maybe kind of as a tangent, to that, and kind of to piggyback on what Sam said, I think a lot of the work we continue to do is around kind of role clarity, expectations of our work, and kind of standardization of, what a day does look like within our respective roles, to really try to have some clear lines of when we work and when we're out of work. That's, a struggle for me, because as I mentioned earlier on, we all deeply care for these patients and for one another, and that care doesn't necessarily stop, when we're not, on the clock. And so really trying to figure out ways of, giving ourselves the reprieve, and taking care of ourselves. But we have so many different resources. We have, well, in addition to all the wellness kind of focus, Stanford Healthcare has a lot of support classes and activities that employees can also engage in. Yoga, obviously there's mental health specialists that are available to us to talk through the hard things that we see. But I would say for the day-to-day, definitely relying on each other. And I think, it is really bonding and connecting to work with, each other in this work, and just kind of keeping the lines of communication open and trying to encourage people to take space and to take time for reflection. And, I think a lot of us who have worked in cancer for a long time, know, it's about living, along a spectrum for sure. And death is part of that life. And so, we're definitely a group that doesn't shy away from talking about death. But, knowing that takes a lot of emotional wherewithal for us, who are doing this day in and day out. So it's definitely something that our leadership and our leaders encourage, their teams to focus on and to be aware of in terms of their self-care.
Thank you so much, Allison. Emily, I've kind of been waiting, but I was going to switch over to you real quick. Just hearing about day in the life, hearing about all of the supports available, wanted to kind of ask you, because you're in the trenches, you're there on the floor. What's the best part about your day when you're working at the Cancer Center? What gets you excited to go to work every day? And you've been here, it looks like, over 6 years. What's kept you at Stanford?
Yeah, so I think for the inpatient side, there's always two things that keep you coming to work and excited about coming to work. And one part, of course, is our patients and really getting to connect with them and guide them through what is often, the hardest times of their life. Sometimes we get a new patient with a new diagnosis who came to the hospital and got diagnosed right there. And so we're walking them through the beginning of their cancer journey. And other times we're kind of in the trenches with our patients who are there sick, and we're helping them feel better and getting through, some rough treatments or complications from their disease. And so those moments to really connect with our patients and really help them understand this journey that they're on, and kind of bring our expertise and our kind of unique role as APPs, having that ability to be the provider and have a little bit more bandwidth to kind of come back and spend more time with patients in the afternoon. So I think that's always, one huge component of what gets us excited and interested and always coming back to work is that patient connection. And along with that is, on the inpatient side, you always see something new. So even 6 years in, 7 years in, 10 years in, I'll have a day where I've never seen, this medical effect before, this complication, this diagnosis, or this kind of workup or treatment. So kind of being on the cutting edge where, Stanford's really bringing in patients with unique diagnoses and then getting these kind of new treatments. We get to see kind of all sorts of new things every day. So even after having been on the job for a long time, you're learning and you're working with people who are excited to come to work every day. It's a teaching hospital. So there's, fellows and residents, and there's that kind of palpable kind of excitement to come to work. And then the flip side for our team is also just the APPs you work with, our colleagues. Whenever you ask anyone on our team what makes them happy about coming to work, it's really the other APPs on the team. Our physicians are phenomenal too, but the folks who are in that team room with you all day long, kind of supporting you, jumping in when you have questions or helping you train for new procedures. And then same with our consultants, we're often consulting with other APPs, and just learning a lot and kind of having lots of opportunities to connect and share our experiences.
Thank you so much, Emily. We've been hearing so much about why work at Stanford that I would love to be able to pass it over to Sam, who can talk about her outpatient thoracic oncology opening that she currently has and kind of what the position entails and what she's looking for in the ideal candidate.
Thank you so much. Yes, we have an open position within thoracic oncology. It's an outpatient position, and it is a full-time position that we're hoping to recruit somebody who ideally has both oncology and thoracic oncology experience. Although, anyone with experience that has a passion and a willingness to learn more, either about thoracic or oncology, but maybe has a little bit of a background in one or the other, also, I would definitely encourage to apply. This position, just put briefly, is, as I mentioned, a full-time position. For most APPs in the Cancer Center, we typically will work 4 10-hour days and have 1 day off per week within that Monday through Friday schedule. So in other words, 4 10-hour days between the days of Monday through Friday. This is a position that does not require any nighttime coverage, any call coverage or weekend coverage. And it also is what we consider an exempt salaried type of position as well. So with that, we have the typical holidays and things, a lot of opportunities for good work-life balance. With that, it is a position where you'd be working with 6 different thoracic oncologists, learning the ways of thoracic oncology, as well as learning about different clinical trials that the team offers at any given time. It is a very collaborative type of position where you see some patients with the physicians, particularly some of the new patients, as well as the opportunity to grow and do some more kind of independent APP type visits once you are well established. We have a very comprehensive and robust onboarding process for which we're really proud because there's a lot of support and very defined feedback and times at which we check in with our APPs to make sure that they're meeting certain metrics and kind of coming up to speed at various times and various levels. This particular position is one where we don't have very much turnover on this team, so it was surprising to us to have a position open. And luckily, the APP who left was someone who had a slightly different research interest, and we were able to retain that person within Stanford and particularly within the Cancer Center. And so now that colleague is just down the hall and is still very happily working alongside the rest of us, and we get to call upon that person anytime we've got questions about that other specialty as well. So I think more details of this position are listed within the Stanford website and the application process. And many of our recruiters are happy to talk about some of the more specific details, as am I, as the questions come up. But there's sort of an overview. If there are more specifics I can answer, please let me know.
Thank you so much, Sam. Depending on what platform you are watching this on, at the end of the streaming event, I will be dropping the link for that specific position there, so you're able to go in and look it over. And for anyone that's interested in applying for that position or looking for additional opportunities at the Stanford Cancer Center, I'm going to pass it over to our talent acquisition consultant, Rick Novak, who can kind of go over a little bit more of the applying and interviewing process, the benefits, the perks to working at Stanford, and kind of what you can expect through the application hiring process.
Good afternoon. My name is Rick Novak, Senior Talent Acquisition Representative, which is just kind of a fancy name for a recruiter. So as Carly mentioned, I'm here to kind of give you an understanding of our application process, what you can expect if you receive an offer, our credentialing process, and just kind of give you an HR overview. Before I get into that, I did want to make one question. I noticed, I think, Chris, you had asked how many fellowship positions are available for the 2025 cohort. The fellowship is technically a separate program from just the Cancer Center, but we do have 2 positions every year in the fellowship for our cancer care cohort. So hopefully that answers your question. So pivoting a little bit, to Carly's point, the best place to start your career search is actually on our career page. You can Google Stanford APP jobs, but really the best thing to do is to go to careers.stanfordhealthcare.org. You can join our talent community. And in order to do that, you don't even have to apply for an actual position. You can upload your CV and your resume, create a profile, and actually create active alerts. So if you go and you look and you don't see a position that really excites you, go ahead and join the talent community, put in an alert, put in some keywords, and we will actually message you as positions come open. Typically, we have a couple of positions that come open every week across all of our departments, not just in the Cancer Center. So that career page is being updated quite literally every single week. So make sure you keep an eye on that. Once you actually start your application, you will then be contacted by one of our recruiters, myself or one of my colleagues. We'll reach out to you and kind of get an understanding of what you're looking for, and we'll give you an understanding of what you can expect in the position. Candidly, we're going to give you a pretty high-level understanding. We are recruiters. We are not healthcare professionals. I tell everyone I've been in healthcare recruiting for almost 20 years, and I have a journalism degree. So we do have to rely on our hiring leaders a lot when it comes to some of the real particulars of the position. But we want you to get a good understanding of kind of what the expectations for the role are, and then also give you as much information as possible so you're not walking in blind. If you are extended an offer, we will then circle back to you after the interview process and we'll work on that offer with you. One of the things that we'll go into a little bit more detail is our benefits offering. We're very proud of our benefits. We actually offer health, dental, vision, long-term, and disability options. We do have CME money. We have a 403B retirement with a match. We have up to 36 days of PTO. Really, really strong benefit offerings. And we can go through those in a little bit more detail after you've applied and we actually get to talking about positions. The big question, how long does credentialing take? So our credentialing takes on average 90 to 120 days. Very standard for what we're seeing for the rest of the country. But with that, that means about that 3 to 4 months after you've accepted a position before you'll be able to start. So just kind of keep that in mind. And again, should you apply, go through the process, and we're actually talking about an offer, we'll go into a lot more detail and make sure that you're prepared to keep that number closer to 90 days instead of 120. Beyond that, we're just really here to support you, answer any questions that we can. Feel free to apply for any and all positions that you feel that you have an interest in. And then we'll work with you if they aren't positions that you're necessarily qualified for, or maybe we are about to make an offer and unfortunately we're not taking any new applicants. We will work with you to look at other opportunities to find a really great position for you in our cancer center or beyond. So we look forward to working with you and supporting you. And feel free to put any questions into the chat that I can answer.
Thank you so much, Rick. We are coming to the close of our time today. I want to thank everyone that joined us for the Stanford Live today. A huge shout out to our APPs over at the Cancer Center for their time and being willing to discuss just day-to-day life, why they love working here, and hopefully encouraging a couple of you to apply for open roles. So enjoy the rest of your Tuesday, and we will see you guys on the next Stanford Live.